Hello friends, we are starting a new feature on our YouTube channel, and that is every week we will be discussing clinical case based MCQs or problem solving type MCQs or objective questions, because we are more and more moving towards such questions in your university exams and even the next or NEET PG exams. So let's start with the first one today. This MCQ was asked on all my social media platforms. So some of you might have already seen it and answered it. Okay, so a patient recovering from an illness is advised eating of fruits and green leafy vegetables, obviously. And the absorption of fruit sugar will require which of the following transporters in his digestive tract? Okay, I have been always suggesting this, that whenever you read an MCQ, whether it is case based or whether it is fact based, never ever directly start reading the options. First, try to answer it by yourself without having a look at the options. Okay, so they have asked about the fruit sugar, which is fructose. So how is fructose absorbed from the digestive tract? That is what being asked. Think about it, try to answer and then look at the options whether you find that in the correct option. I mean, find that in the options, your answer. Always then most likely your answer is going to be correct. So this should be the strategy for solving all the MCQs. Now coming to the particular question, they are asking about fructose absorption from the digestive tract. So we will discuss how these monosaccharides are absorbed from the digestive tract. I'll first talk about glucose and then we will see how fructose is different. Okay, so here is a digestive tract and there are cells which are lining the digestive tract, as you can see in the diagram. In the lumen of the digestive tract, we have these nutrients, whether glucose or fructose. Let's start with the glucose first. Glucose or any nutrient to be absorbed from the digestive tract into the blood, it has to cross two membranes. Here is a blood vessel. So if the glucose has to enter the blood vessel, it will have to cross two membranes. The cell which is lining the digestive tract has two sides. The side that is facing the lumen is called as apical membrane, and the side that is facing the blood vessel is called as the basolateral membrane. So the cells which are lining the digestive tract have two sides: the apical membrane facing the lumen, basolateral membrane facing the blood vessel, and the glucose will have to cross these two membranes to enter the blood vessel. That is how the glucose will be absorbed from the digestive tract. Now very critical point is coming up, so please listen to this carefully and retain it forever. Whenever the glucose has to leave the cell, well, look at this, why I am saying it is because glucose will have to leave this cell to enter the blood vessel. That means glucose is going to enter the cell from one side and then leave the cell from the other side. So point is, whenever the glucose has to leave any cell, it has only one transporter to depend on, and that is GLUT2. Okay, let's take the example. There is a liver cell or a muscle cell, skeletal muscle cell. You know, they store the glucose in the form of glycogen. Well, this is not related to the MCQ. This is just a separate point of view on glucose. So just making a point here. Whenever the blood glucose is to be increased, a liver cell or a muscle cell has already stored glucose in the form of glycogen. Now this glycogen is broken down inside the cell. After all, glycogen is a polymer of glucose. It's glucose, 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 glucose. That's glycogen. So glycogen is broken down to make glucose inside the cell. This is liver cell or muscle cell. And then this glucose will leave the cell to enter the blood vessel. It will leave the cell to enter the blood vessel. What transporter will be utilized? Come on, say it now. Glucose has only one transporter when it comes to leaving the cell. It is GLUT2. Yes. So whether it is here where glucose is leaving the cell and entering the blood vessel, or whether it is here in the case of digestive tract, or even in the case of renal tubules, whenever the glucose has to leave the cell, it has to use GLUT2. So okay, let's just bring it to the center. Yeah, so on the basolateral membrane facing the blood vessel, the transporter will be GLUT2. So glucose will leave the lining cell and enter the blood vessel. The other side, that is apical membrane, has another transporter. Now look, whenever glucose from the lumen is entering the cell, it is going from low concentration to high concentration, and therefore it will be a secondary active transport for glucose, and therefore it will use the secondary active co-transporter or the co-transport carrier protein, which is SGLT1, the secondary active transporter, which will transport the glucose from its low to its high concentration. Now let me summarize this for glucose. Whenever glucose is absorbed, it is carried from lumen to the blood vessel, I beg your pardon. It is going across two membranes, it is crossing the two membranes. SGLT1 carries it from lumen into the cell because low to high, and then high to low it is leaving the cell and entering the blood. So that will be GLUT2. Facilitated diffusion, high to low. GLUT2 is a facilitated diffusion carrier protein. So that's how glucose is absorbed. Now let's talk about the fructose absorption, that is the MCQ. Fructose utilizes glucose transporters. First point, fructose does not have its own transport proteins separate, exclusive. So fructose utilizes glucose transporters, point number one. Point number two, fructose also will have to cross those two membranes, the apical membrane and the basolateral membrane. Yes. Now since it is utilizing glucose transporter to leave the cell and enter the blood vessel, it will also utilize the same carrier protein, that is GLUT2. Very obvious. It is leaving the cell, this lining cell, to enter the blood vessel. It will use GLUT2, the glucose transporter type 2, facilitated diffusion. But in the case of fructose, when it is going from lumen into the cell, that also is from high to low, and in that case it will again utilize a facilitated diffusion transporter. This time it will be GLUT5. So to answer our question, the fructose absorption requires two carrier proteins, GLUT5 and GLUT2. By using GLUT5, it enters the cell, lining cell, and by using GLUT2, it leaves the cell and enters the blood vessel. The point to be noted is, when it is entering the cell, this lining cell, it is going high to low because you have consumed fructose and or maybe consumed sucrose and it has been converted into fructose and glucose. So that fructose is high in the lumen of the digestive tract and relatively low in the cell. So high to low. But once it starts going into the cell, its concentration begins to build up inside the cell. So when it leaves the cell and goes into the blood, again it is going high to low. I hope you have understood this point. Initially it is high in the lumen because you have consumed it in the diet in the form of fruit sugar or in the form of sucrose maybe, which was converted into fructose and glucose. So high always in the lumen, and then from there it enters the lining cell, it is going high to low. When it enters the cell, the cellular concentration rises for fructose. So when it is going from the cell into the blood, again it is going high to low. So again it is utilizing facilitated diffusion transporter, that is GLUT2. So the answer to this question was GLUT5 and GLUT2 are the transporters utilized by fructose for its absorption. The point to be noted is, in the case of glucose, it was going low to high and high to low. Low to high to enter the cell and high to low to leave the cell from the other side. And therefore, it was utilizing secondary active transport carrier on one side, that was SGLT1, to go low to high, and then high to low facilitated diffusion, that's the other carrier protein. So that's the answer to the question. And finally, why is it that the transport is different from glucose and fructose? It's because their metabolisms are different inside the cells. Fructose is not metabolized by every cell. Let's say liver cell or some specific cells are going to metabolize fructose, and its metabolism is quite different compared to glucose, and that is why this situation arises where their entry into the cells and exit is slightly different, at least the entry from the lumen into the cell. So that was the answer to the question. Every week we will have one or two clinical cases and MCQs based on those cases, or some problem solving type of objective questions.